You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, the keys to a natural-looking facelift. With us, we have an expert on the topic. He's Southern California's go-to board-certified plastic surgeon when you want to look natural. With us, we have Dr. Paul Chasan. Dr. Chasan, welcome to the program. Welcome back.
Thank you, Randy. Nice to see you.
Now, you brought a lot of photos, so we'll do our best to get to those. But for people that don't know you and don't know your practice, you're right there in Del Mar. Who's the typical patient? And what are the different services that you offer?
Well, I have a comprehensive plastic surgery or cosmetic surgery practice. And by comprehensive, that means I see people from 16 to 81. We see girls that have their first rhinoplasty or nose job at 16 years old. We see 20-year-olds who are having breast augmentation. We see liposuction. We see women who just have children and they've lost their breast volume. They need tummy tucks after 4 kids or twins. So we're seeing that group. We see the facial rejuvenation group, and the first time they have upper eyelids in their 40s. And we see early facelifts in the late 40s and early 50s. And then we see full facial rejuvenation all the way up through 80. So
what's the oldest patient that gets a facelift these days?
Late 70s, early 80s.
Is that right? Is that right?
It's a whole new paradigm out there. I mean, when used to be, when you're in your 60s, you're done. Now, people in their 80s are on their second marriages and they're, dating and they want to look good and they feel healthy. So, I mean, as long as they're healthy, they want to have this stuff done. I remember one lady, she was 81, and I kind of questioned her, why do you want to do this? And she says, what do you think? Just because I'm 81, I stopped looking at the mirror? I mean, so I kind of laughed and I thought nothing of it. I said, hey, listen, we need to do a full pre-op, and and I thought she was gonna just leave. She came back the next day. She went and saw her doctor, had all her labs, and she wanted to go, and she was thrilled. She had a boyfriend that was 10 years younger than her. She wanted to look great.
Now you do all the skincare stuff too.
We
Is that
do.
right? You have
We
the
do.
lasers and all the stuff.
You really can't. If you're in the facial rejuvenation business, i.e. surgical or non-surgical, you can't do one without the other. I mean, just as important as doing the structural part of a facelift, it wouldn't look right if you fixed everything and then they had terrible crow's feet, or that the character of their skin wasn't excellent. And having good skin is actually it's work. Skincare doesn't just happen. You just don't do a laser or a facelift and then say, okay, I'll see you in 10 years. People should be doing Botox, skincare. I mean, turning over the skin is an important aspect of looking your best. And so when you put those all together, that's how you get great results and natural results. And people I have one lady, twins, 69, the best looking 69-year-olds you've ever seen. They're beautiful. And you know what? They keep up with the program and they look great and they're healthy and they're vibrant. And at 69, one's still dating and has a new boyfriend and she's having a ball. They're traveling all over. So age is kind of, nowadays it's just not that important how old you are. It's how you feel, and you want to look good to the world, and when you look good, you feel good, and that all works.
At the top of the show we said you're the go-to guy for natural results. Do the patients, are they worried about looking done? I mean, on that consult, is there a discussion about this?
Every patient. Every patient.
Like, what do they say? What do they want to know?
Every patient says, I've seen bad facelifts. I don't want to look like that person. Everyone.
Oh, really? Okay.
Yeah. Or you mention the word brow lift and they say, oh, dear, the headlights. I mean, look, we've all seen bad facelifts. And you know what? It's a black eye for me when I see one, because then people have the perception that that's how facelifts can go. But, bad looking facelifts is are one of 2 things: inexpert surgery or multiple surgeries. And so
you have to have an eye for this?
What's that? Absolutely. And not only
there's more art to this?
There's a lot of art. And the more I've been doing this and the longer I've been doing, the more I realize that there's the artistic side to plastic surgery is huge. And so, people come in and they compare, well, he's a plastic surgeon, he's a plastic surgeon. We are not a commodity. And if you look in life, this Gaussian curve of life where there's a bell-shaped curve, when I first started practicing, I thought it was fairly narrow. Well, he's a plastic surgeon, he's a plastic surgeon. Maybe the results would be similar. It couldn't be farther from the truth.
Is that right?
The curve is like this from talent, technique, artistic ability, attention to detail, passion for what you do. If you're not passionate about your result, you're not passionate about how you take care of that person. And there's a lot of guys who aren't. Here's example one. Can I show you this
All right,
picture?
let's take a look.
Okay, so this is a 65-year-old lady, okay? She's a super nice lady and vibrant and out there and hikes but not dating, not particularly confident. And she came in and she knew she wanted something. A lot of people don't know exactly. My job is to look and say, you need this, 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 and
Do
this.
they tell you like this bothers me?
Sometimes they say this bothers me. I say, well, I see that, but I think this should be done, or maybe not, or this is an option. And we have this communication about it. And so look at her neck. I mean, look at her neck.
Yeah.
Look at her eyes. Look at her nose. I mean, when you look at those things, like if I could take like a painter's brush and just define her neck, or in her case, I was pretty strong about you need to do your nose, because if we didn't do her nose,
Because what, it's dropping a little bit?
yeah, and the aging nose would stand out even more prominent. And so oftentimes, not every time, but oftentimes I will do the nose as part of the facial rejuvenation. People kind of exclude the nose of the whole facial rejuvenation part when it might be one of the most prominent, best features to improve.
Let's take a look at the after.
So yeah, there you have it.
Wow.
If you look at her neck, and her neck is now, a defined neck is a beautiful thing. If you look at the before picture, you'll notice that the one eyebrow is lower than the other. Her eyelids are heavy. You certainly notice her nose. You notice her jowls. And so then look at the after and the before. You'll see those things have been improved. The jowls improved. The neckline
Is this called a full
improved.
facelift, what you did?
What I actually did on her was a mini or petite facelift, and I find combining multiple techniques give a natural result with less downtime. So in her case, I did what I call a petite lift plus liposuction of the submental area.
What does that mean? Liposuction where?
Of the neck.
Of the neck? Okay.
Yeah, so I did liposuction of the neck. And one of the things that's really improved facelifting and got me to the next level is fat transplantation. And that's relatively new. I'd say, in the last 10 years, it really started getting big. I adopted it about 7, 8 years ago. And I think it's one of those little subtle things that no one would know I'm doing that make that result even better. And so if you look at her, I did a full facelift.
So under her eyes, you put her own fat?
I do. The pre-jowl area, the jawline, the cheeks, lower eyelids, upper eyelids. I put little aliquots of fat everywhere I can. And what fat does is it helps plump, it helps rejuvenate in very specific areas. It doesn't make your face fat. It just allows me those subtle little areas to smoothen the wrinkles. And then there's, as you know, with fat, there's the stem cell effect. Fat cells have a lot of stem cell. And so the skin overlying where I inject the fat looks better. It shines better, it looks better, it's more vibrant. Does that lady look 65 years old?
No.
Okay.
I mean, she actually could look about early 40s.
And that's what she gets.
I think anybody at home could also agree with that.
And look how pretty she looks. More important than just how old she is or that you reduced age is look at the beauty. Look how pretty she is. In fact,
she does look more attractive on the after.
Yeah, and in fact, she's dating, and she's now, when she goes out, she says men are fighting over her. Which is,
fights over this woman. That's good.
Isn't that awesome? I mean,
That's good,
okay,
good.
so something I could do then packs her life like that. She is so thrilled. She is so thrilled. And so we've changed her life. She's thrilled, and she looks beautiful. What else is there? There's another patient I want to show you.
All right.
This lady is 62 or 63 years old, and she super golfer, active, and she just felt tired. She's married. She's has a very active social life.
So that's standard aging. I mean, if you live to 62, that's going to happen. It's going to fall.
Right. So if you look at her pre-picture, Randy, you know her neck is a little lax. Her face just is starting to get that slight aging. You can just tell. I mean, people, when they look at a face, they're not very sophisticated the way we look at faces, right? Young or old, attractive or not attractive, right? So in her, if you look, her neck's starting to sag. She's losing some volume in her face. So what I did in her is I did a petite lift, the mini lift. I did fat transplantation you see where her lower eyelids look a little sallow, upper eyelids, the pre-jowl area. So I typically, where people age And yet fat atrophy, fat drop is the central third of the face. And so if you can replace a little bit of that volume with fat, instead of like fillers, you know, the beauty about fat is you can put little aliquots of fat here, here, and here, here, here. I mean, it would cost you thousands of dollars to try and do that with a filler like Juvederm.
And it stays,
And the fat, and a good percentage of that fat stays. And so people always ask me, how much fat stays? Well, you know, if you use small amounts, a lot stays. And the number, you know, across the board is 50%. I think it's better than that if you're using smaller amounts. So Randy, look at her profile. I mean, look at...
It's nice.
Do you think she looks younger?
Yeah, yeah.
Does she look prettier?
She looks prettier. So she's thrilled after this.
Thrilled.
What do they say? When it's all done, they're all healed up, do they come in? Do they want to give you a hug sometimes?
Oh, all the time. You know what? This kind of lady, I mean, she's already a pretty lady. You know, she just, in her case, she just felt aged. She looked like she looked tired. In her case, she's just thrilled, and they come in kind of like they're walking on air, honestly. They just kind of walk in and they're smiling. They're pumped up. They look great. They see themselves in pictures and they love the way they look and they feel confident. They dress better. They look better.
So they're on Facebook maybe with selfies now.
Yeah.
In their 60s. Looking good.
We see it. We see it.
When should somebody get a facelift, by the way?
You know, that's a question people ask me all the time. So the idea of get a facelift before you need one is wrong. You know, there's a sweet spot. Should you wait until your neck is sagging to your chest? No. And so when it starts to bother you, that's when I tell them, get a facelift when it bothers you. So when's the age? Mid to late 40s is kind of the early side. The sweet spot's early 50s. You know, and it really depends on genetics. There's a blue-eye blonde in Southern California age much more quickly than Italian or Hispanic, darker skinned person. That's just life. And so, you know, when it bothers you, when you
look in the mirror and just see your own mother.
Yeah, when it bothers you, see pictures. People are asking. This is what people tell me. People are asking me, "Are you tired?" No. I mean, that's one.
That'll ruin your day, right?
Another one. I was at a friend's wedding and I saw my pictures and oh my God. Or you know, a lot of times when you see a picture of yourself that's not you in the mirror but somewhere else, and you notice it. Those are common things. Randy, it's amazing when you feel good about yourself, the endorphins or however that chemical mediation works. I see these people, they want to be seen. They love the way they look. Their confidence goes out
so
off the roof.
So when people hate the way they look, you say they don't go to things.
They don't go to events. They don't dress up. They're not wearing makeup. They stay kind of frumpy. And when they look like this, like the two pictures you've just seen, they want to go out. They want to dress up. They're motivated. They feel good about themselves. They want their friends. They all of a sudden they're asking their friends to go to lunch because they want to hear what their friends say. Did the friends say, "Oh, you look great. You look great." So yeah, I hear all that stuff. It's great.
So good. You brought some old photos.
Oh, yeah.
And we're short on time. So
okay. Well, this is another one. 59-year-old lady who just looked, you know, felt like she looked a little tired, and she did. I mean, she's an attractive lady. This is another one who I feel like a lot of times the nose is part of the aging process. And I feel that if you don't do everything in balance, then you don't get a natural result. And I see that all the time because sometimes people dictate, I don't like my neck, just do my neck. And I'm like, no.
Well, what's wrong with just doing the neck?
Well, the issue is what are you trying to accomplish here? I mean, the idea is not just to do a procedure. The idea is to create beauty, harmony, balance. That's important, okay? And when you talk about, you had mentioned natural results. One of the things you had mentioned is that look of having plastic surgery done. And when you notice something like a cleaned up neck and then the rest of the face is old, that catches your eye. That's a good point. That's one of those things that catches your eye. You say, there's something wrong with that person. And so oftentimes I have to spend my time educating someone. Look at the after. Now, if you look at the after, look how much prettier she looks overall, just the whole. Now, this is a lady who we elevated the tip of the nose, took a little bit of the bump or hump off it. Yeah, it wasn't a huge rhinoplasty, but it made a big difference. In this lady also, I used more fat than I normally do.
So you put the fat, what, under the eyes?
Everywhere. Now, when I
What do
say
you mean
everywhere,
yeah.
okay. So the typical areas, especially on her, in the before fat transplantation, I could not make that perfect jawline. Go back to her side pre, and you see how she has that jowl there, okay? And she, you know, that's the farthest from the pull of a facelift and where you have the least ability to get a great result. With fat, I'm able to improve that.
So you add a little bit somewhere in here to balance it out?
Yep. Jawline, I'm able to make the jawline look like a little more defined. Then the lower eyelids, there's a transition zone. A lot of people have shadowing under their lower eyelids, and the fat helps smooth out that transition. A lot of people lose fat in the upper eyelids, and that's something I've been doing for the last 2 or 3 years. I've just been thrilled with, is doing fat transplantation to the upper eyelids. Sometimes I don't even have to do an upper eyelid blepharoplasty.
Upper eyelids? Up here?
Yeah, and the fat works beautifully there. And then the temporal hollow. Some people have, you know, it's normal to have a flat temporal area, but sometimes as we lose fat.
Right here?
Yep, as we lose the
Get
fat.
a skeletal look?
Yeah, they look aged. And so
Interesting.
a youthful age is more of a plump, youthful looks plump.
But not overdoing it.
No, old looks hollow. And so when I say I'm using fat everywhere, again, it's very small amounts of fat. I'm not just taking fat and just shoving it in there. It's very specific, very small aliquots of fat, but you can see what a big difference, and you put it all together. Look at her before and look at her after. I mean, you tell me, does she look younger?
Yeah, and she doesn't
look
done.
prettier?
Yeah, she looks prettier.
Does she look like she had plastic surgery?
No.
Okay, that's it. There you go. You answered the 3 questions. Younger, prettier, doesn't look done. Ta-da! I mean, it sounds simple. It's taken my whole life to be able to do this on a regular basis. And part of my job is to discuss this with people, let them understand where I'm coming from.
And you do everything right there, right? I mean, you have your own operating room. You have a huge facility.
Yes, I really...
By the Del Mar Plaza, right? Behind the Starbucks?
Yes, across from LeBare's, near
I got a
the Del Mar
tour.
Plaza.
You didn't give me the tour, but it's large.
I do a lot of out-of-town people. We've had a lady from Israel. We've had a guy from Saudi Arabia. We've had 2 from Chicago just in the last month. And so they stay at LeBare's. They come in, we ferret them back and forth, and we can keep them overnight. So every facelift stays overnight. Why? I mean, you know, because the experience is so much different. Pain, nausea, all the negative things that in surgery are totally controlled. And if they're in my office with my nurse dedicated to them, and we can diminish those dramatically and not being jostled after surgery, after anesthesia, going somewhere in a car, and they can just stay there and chill.
Sense.
The next day, they feel good, they look good, and out the door they walk 10 feet, and the car is waiting for them right there. So you tell me what experience you want to have. So, you know, it's crazy, but I'm the only plastic surgery facility in San Diego County that has that kind of a setup.
That right?
Yeah. Let me show you another patient.
All right.
This one's 73 years old. Talking about, we're in a new era. This lady is a Pilates instructor, 73 years old, super fit, really like a big personality, really fun, nice, warm. And 73 is just a number for her, but she felt that she looked aged, tired. She's totally comfortable in her own skin. It's not like I have to look young for any particular thing, except just to make her feel good. Just to make her feel good. And you know, if you look at the before picture, I mean, she looks aged, she looks tired. And if you look at, really on her, all I did was a petite lift on her and to improve her jawline and neck. So you look at the after. Again,
wow.
She doesn't look, in her case, she didn't need anything else. Some people don't need everything, right? Some people need just the neck.
You did some skincare or anything like that with her?
She does skincare. And, you know, and the fact is because she exercises, that's why she's preserved so nicely at 73. So look at her after picture. I mean, does she look 73?
No.
And so the idea is, all I did on her was the petite lift. That's all she needed. And you know what? She's thrilled. She's youthful looking. She's pretty. She's active. She doesn't look like she had any work done.
So you've been doing this a long time. Are the patients that are getting this done getting older and older, younger and younger? Is it more of the soccer mom crowd? I mean, people that normally would never dream of doing something, any surgery? are getting it done? Has it become more mainstream, I guess is what I'm trying to say.
Yeah, I think it is definitely more mainstream. There's not a stigma attached to it. You know, people used to be like, how much time until I can be seen and no one would know? Now it's like, how much time until I don't care? They just say, I don't care if people know until I can not scare kids at the store or something. You know, I mean, really, they don't mind at a week or 10 days going out with their friends. Their friends know they have a couple mild residual bruises they can cover up with makeup, or they wear sunglasses or something. But they don't care that people know as much as in past. So I would say that, yes, people talk about it more, and then you'll see that someone has it done, and then their friends see that they have it done.
So a lot of referrals from their friends.
Oh yeah, now they want it done. I mean, once they see, oh my God, you look amazing, next thing you know.
Who's your guy, they'll say.
Yeah, that's exactly right.
Dr. Chasan, right? You know, anybody looking at the, I'm trying not to side with you, and people need to know I'm not endorsing you, I'm just asking the questions, but I mean, like you said, they featured your work at one of the big shows, big plastic surgery shows. Are you at the top of your game?
I think so.
Like when you look at a face, you know what you can do?
Yeah, I'm at a very good part in my career. It's fun to be Paul Chasan right now. And I'll tell you why. I mean, I've been doing this I've been in practice 22 years and trying to be the best I can for 22 years. Every day, every time I pick up that knife, I'm trying to be the best I can. I've passed the learning curve. I develop new techniques. I'm still passionate about what I do. And so when I take on a case, it's not like a mystery anymore to me. I'm really giving what I consider the best care, the best surgery, the most particular type of surgery I can. And so, when you put that together, yes, I'm on my game.
Good, good. One more. Time for one more.
Okay. And this is a lady who had a prior facelift, and sometimes, as you mentioned, sometimes they don't look so great. And so she had a prior facelift, and you can see she has really significant residual jowls. Her nasolabial folds, or that area between the nose and the lip, doesn't look good. I mean, when you look at her, she looks like kind of an older lady.
Okay.
Doesn't look particularly beautiful. And she was a little bit of a challenge for me. So I did a Petit lift. I did liposuction of the neck area, and I used a lot of fat transplantation to improve the pre-jowl area, to improve the nasolabial folds, to improve the lower eyelids. And you can see, look at her after picture. I mean,
wow.
What a difference. I mean, that's a lady who looks attractive.
Looks like it almost could be her daughter, by the way.
Yeah.
I don't think anybody would disagree with that.
She is thrilled with her result. And if somebody's thrilled with their result, they tell their friends. That's how I stay busy. But it makes me happy. It really makes me happy. And
it's like a younger version of herself.
Yep. Yep. And this is kind of the things over years and years and years you develop those skill sets.
So with her, you did her eyes? You added fat to fill in her own fat.
I used her own fat to fill in the lower eyelids, to fill in the nasolabial folds, and the pre-jowl area.
And her neck, and she looks about, 10, 15 years younger?
Yep, I think she does look at least that.
So if you get somebody in their 70s, you're gonna get them back to about 50?
I don't make any promises.
I mean, how about this?
I would tell the average person 10 years. 10 years is probably pretty reasonable.
What did they say?
They usually say 10 years, but it's more important than that. Randy, it's much more important than just turning back the clock 10 years. It's more about beauty for me.
Okay.
It's about beauty. I think that if someone looks beautiful, I don't really care that they pulled 9 years or 8 years or 15 years. If they look beautiful, that I think is the most important thing.
Yeah, she does look prettier in this after. Did they tell you, like, okay, so when they're healed up and they come in on the consults, after it's all done, what are some of the things that they tell you? Do they give you like I can't believe it, people are...
Oh, they tell me that all the time. I mean, oh yeah, it's not so much, it's more about what's going on in their life. So I'm dating, guys are fighting over me at the bar. I've never had that in 20 years. No one's fought over me in 20 years. Their guys are fighting over me in the bar. When I hear that, that's awesome. Or when I see a 69-year-old dating a 55-year-old, I mean, and they're totally happy and they're in love. I mean, that's great. It's great.
So in the future, do you think it'll be especially because you have all the technology for the
Right.
skin and the tightening and everything else, do you think it'll be very hard to identify people's ages in the future?
Oh, entirely, yeah. And
Like
now,
you would never guess the ages of some of these 70-year-olds you've shown me today.
Right, right. Well, I think that just we're in a different era. We're totally in a different era. 70 years old is not that old. I mean, it's just not that old. And so it sounds old to us because we were born in an area when that was old, but it's not old. And a lot of people's aging and their lifestyle are incongruent, And I think some people feel young and they travel and they're fit and they just need a little help. Randy, let me tell you something. It's funny, the workforce is a very important aspect. We had talked earlier about in the workforce, do these women see a difference in jobs? Would you want to be with a more youthful person, more vibrant looking, or older? I had a lady who was in her early 60s. She was the head of one of the big divisions of a telecommunications firm. I think she was responsible for, I don't know, $500 million for that company.
Okay.
And she was looking at her next level. And we did facial rejuvenation on her. And she got that promotion. And she's in charge of $2 billion in assets for this huge telecommunication. And she came back and she goes, do you know, I really hold a lot of the responsibility for my job promotion to having that facelift.
Yeah. And we were talking even in the green room that it's like, even if you're interviewing, let's say, real estate agents, if one looks exhausted and tired and one just looks fresh, with all things being equal, you want to hire the one that looks at least like they have more energy, right?
Well, we live in a visual world. Any way you slice it, there's been studies, we live in a visual world. And so if you want to participate in this world, you have to know that we live in a visual world.
Is this the new aging gracefully? Getting a little work done?
Absolutely. This is aging gracefully. This idea of aging gracefully so you look old and tired, that's not aging gracefully. Aging gracefully is picking your surgeon correctly and looking really good throughout your aging years.
We are out of time. Great stuff. Final message though, somebody watching this, they don't like their neck, their jowls, or whatever. They don't like the way they're aging, but they're still afraid for whatever reason. They're bothered by it, but they're afraid of surgery. What do you say to them?
Well, no one comes in wanting to do surgery or spend money or have recovery, but the people who've had it done wish they did it sooner. They really do. They feel better. They say, I wish I would have done this sooner. I would have enjoyed the benefits of what I just did for that many more years. So I think that you owe it to yourself to know your options. Come visit, talk to me. I'm happy to talk to you about it. It's an hour of your life, and you might find that you'll benefit.
All right. I want to thank you for coming on the show. Always a pleasure to have you on the program.
Thanks.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.